Assalamualaikum warahmatullahi wabarakatuh. My name is Scerrati E binti Muhammad Noor, and we are from Group 2. We present about the importance of correctly choosing and wearing face masks. Since COVID-19 pandemic happened, face masks have been normalized, and we can see that till today, there are people that still wearing face masks even though the ban had been lifted. But during pandemic, a lot of people complain about wearing face masks even though they know that the face masks are important in order to minimize the spreading of virus COVID-19. One of the complaints that we often heard is it was difficult to breathe when they wear face masks. During this time, we also had been exposed with different type of face masks that we never bothered to know. So this presentation will teach us the importance of wearing face masks, the differences of face masks, and on how to choose them correctly.
Bismillahirrahmanirrahim. So, I am Brother Muhammad Ashraf Samuel bin Muhammad Wahyuddin with metric number 2125903. So, I will continue the presentation with the type of mask and its properties. So, basically, we have three types of mask, which is in medical mask, non-medical mask, and also respirator mask. So, the type of medical mask is surgical mask, while non-medical mask is such as cloth mask and respirator mask such as N95 mask. So firstly, for the surgical masks. Surgical masks are single-use disposable masks mainly used by healthcare professionals, especially in medical setting. So it's been used to protect themselves and others from the spread of airborne infectious disease, bodily fluids, and particulate matter. So basically, surgical mask prevents large particle which is higher than 10 nanometer that spread by cough and sneezing. But surgical mask does not fit tightly when it's been worn. And surgical mask, it actually filters 95% of bacteria efficiently. Next, we go to the N95 mask. N95 respirator or N95 face mask is an important piece of PPE or health practitioners. This is because it can block 95% of microscopic particles. It can reduce exposure to very small airborne particles or contaminants. And N95 respirators fit more securely on your face compared to surgical masks. This is why it's been used in health practitioners, because it can help to reduce more exposure than surgical masks. And also important that not all N95 respirators are tested for fluid resistance rather than surgical N95 masks, which is for persuasive settings. And the last one is cloth mask. Cloth mask is one of the non-medical masks, which is helped to prevent respiratory droplets from traveling in the air and onto other people. It's been used usually as the secondary mask. And it's been commercial as it can be reusable, it can be washed after being used. But know that cloth mask is 50% less effective than surgical and N95 mask. And that is the reason why it is not applicable in any medical setting. And lastly is that it is insufficient protection from aerosol. That's all from me. I'm passed to the next presenter. Thank you.
Assalamualaikum, my name is Aisha. I'll talk about how to choose and wear a face mask correctly. First, to choose a face mask, it must be fit to your face with no gaps along the edges. Gaps can come from choosing wrong size of face mask or when mask is worn with facial hair. There are a lot of face masks to choose from. You can choose any type of face mask introduced earlier, depending on what kind of environment or surrounding you are in. If you're indoor or you're using public transport, you can wear any type of facial mask that you like. If you're exposed to medium to high risk of getting infection, for example, you make social contact with anyone who is very sick, especially with viral diseases, you should wear high quality face mask, or you can even consider wearing a respirator. For children 2 years of age or older, high quality and comfortable face mask or respirator are recommended. Some types of respirator may feel different to the children. They are used to wear cloth or disposable procedure masks. Did you know there are special face masks for deaf people? Deaf people or people who need to see the shape of mouth to make proper vowel sounds have special masks for them, which are clear mask or closed mask with clear panel. Now, let's move on to how to wear face mask correctly. Any face mask or respirator should be fit to your face where there is no gap along the edges and around the nose, so it provides you optimum protection. Face mask should be worn properly by covering nose, under chin, and of course your mouth. It also needs to be comfortable to the users so they won't remove it frequently, which can reduce mask intended benefits. Cloth and disposable procedure masks can be worn together, where disposable mask is worn underneath to the cloth mask. You can also wear cloth mask or disposable mask together with a filter or bracer. For disposable procedure mask, make a knot from the ear lobes so the edges of mask will join together. This is to make sure mask is fit to your face and no gaps can allow the passing of airborne particles. To remove face mask, you can untie the strings behind your head or stretch ear lobe, then fold the outside of covers together. For reusable cloth face mask, put the wet or dirty face mask in a sealed bag until it is time for you to wash it, while dry or clean mask can be kept in a breathable bag. Remember to wash your clothes mask once every day. When you want to eat, keep your mask in your pocket, purse, or paper bag. And don't forget to wash or sanitize your hand afterwards. Face mask should be thrown away after worn once. For respirator, you should check on the product's instruction on how long a respirator can be worn. Both face masks and respirators can easily be thrown away together with your general domestic waste.
Before the COVID-19 strikes, face masks are not compulsory for people who are healthy, in which they are not having any flu or any other infectious disease. But now, face masks seems normal to most of us. Several studies, for example, Freud and Nose from the year 2020 and 2021, they revealed that face masks affect the identity recognition by altering face perception abilities. We also cannot really tell if a person we met just now was someone we know or someone we not. This is because we cannot differentiate between the familiar and also unfamiliar faces. Other than that, face masks diminish the ability for us to correctly classify emotions and also facial expressions. For example, Carbon from the year 2020 found that many emotional states such as happy, angry, or sad are largely misinterpreted when face masks are used. Moreover, a study on scholar-aged children carried by Carbon and Serrano on 2021, they revealed that masked faces can impair children's emotional reading ability to a different extent. This means maybe they can read our faces as angry, sad, also all the negative emotions. In fact, we didn't mean any of those things. Therefore, based on these studies, we can say that face masks may be difficult for some of us to read people's real emotion in delivering what they are saying. But we cannot deny the fact that it can actually reduce the risk of virus transmission.
Okay, so I want to talk about the effectiveness of using masks during the COVID-19 pandemic. We all know that the COVID-19 pandemic is caused by the SARS-CoV-2 virus. It uses the droplets, the water droplets that we produce during talking as a transportation device to directly enter our mouths and infect our organs. The mouth is the main point of entry for this virus. But if you have a mask, let's say, this mask will act as a barrier to protect that said droplets from entering our mouth. Now, that if we sneeze, that droplets could enter our body through other means. For instance, it could get to our eyes, it could get to our hands, and if we forgot to wash our hands, we could get infected. But overall, the mask is very effective against fighting COVID-19.
Hi, I am Ralia Hakimah binti Nazmi with the metric code number 2212420, and I will relate this topic with the knowledge on anatomy and physiology about respiratory system. As we know, our respiratory system main job is to move the fresh air or oxygen into our lung, and it will be absorbed into bloodstream and it will be carried throughout the body. This process is called inhalation. At each cell in our body, the oxygen will be exchanged with the waste gas that we call carbon dioxide, and the process is called exhalation. We have two respiratory tracts, which is upper and lower respiratory tract. Upper respiratory tract consists of nose, nasal cavity, paranasal sinuses, and pharynx. In the nasal cavity, we also have nostrils. Now, we want to focus about the filtration of air. Why it is important to wear masks in the right way? We can only filter big particles through the nostrils, but if the particles is too small, the particles may go through the lower respiratory tract, and it may cause a lot of problem to our lungs, such as have short respiration rate and also can cause asthma disease. By wearing the mask, we can avoid this such of problem because the mask can also help to filter those small particles from getting into our respiratory system. Maybe just a little, but it still helps.
Bismillahirrahmanirrahim. So for the conclusion, we all know that wearing a mask nowadays is not a compulsory rules anymore. However, what we do know is the obligation of everyone in taking care of their own health. Thus, wearing a mask is important, and we should wear a mask when we go outside or to the crowded places, because we all know wearing a mask itself will reduce us from getting any infection from others, and also will protect others from getting infection from us. So, wearing a mask also is good hygiene in general. And Allah Subhanahu wa Taala also said in Surah Al-Baqarah, وَلَا تُلْقُوا بِأَيْدِيكُمْ إِلَى التَّهْلُكَةِ, which is, do not let your own hand to throw yourself into the destruction. This destruction also means the illness, the disease that we should not get into. So that's it from us. Assalamualaikum.